Good evening, everybody. I'm just going to start recording. Oh, it starts recording automatically. That's exciting. Welcome, everybody, to the PG Dip CBT course open evening. We're just going to start with introductions, and then we've got a presentation, and then we're going to have a bit of time at the end for questions. Thank you to those of you who've posted on the Padlet already. We're going to make sure that we answer as many questions as we can today, bearing in mind that really with the questions, we want to encourage you to ask questions, but try and make them as general as possible. We're unfortunately unable to answer questions about people's individual circumstances, but we hope the majority of questions will probably be covered during the presentations. But please do use the Q&A function. If you have a question, please type in at any point. That would be great, and then we will make sure we have time at the end to answer those. So my name is Alice Kerr. I'm the course director, one of the course directors on the King's College London course. So welcome, everybody. I'm going to hand over to Sophie to introduce herself now.
Hello, I'm Sophie Mays. I'm one of the course tutors on the King's course.
I'm Rita Wu. I'm the Programme Director of the CNWL and Royal Holloway course.
Yes, and hello everyone. My name is Eligius Siekaviskas, and I am a Senior Administrator of the IAPT course, the Royal Holloway.
Thanks, everybody. So, as I said, I'm going to start off with the slide presentation, and bear with me just while I start this, and hopefully everything will go to plan. Right, this should be it. So I will get that started now. Okay, so yes, so you are attending this open evening because you're interested in applying for the course, which we're very excited about. This course runs from October, and it's a year-long course. It's a full-time course, and we're going to tell you a little bit more about what to expect. Now, because we are operating across both London-based courses tonight, we're going to try and keep things as general as possible. There's a lot of similarities between the two courses, and there are some slight differences, and we will try and kind of think about those as we go along as well. But mostly we're thinking about the shared characteristics across both courses. So this is a postgraduate diploma in cognitive behavioural therapy, and really this is a post-qualification training. So really you'll be somebody who has a good amount of experience already working with common mental health problems in a mental health setting with adults. And during this year-long training, we train people in evidence-based CBT, really for the common mental health problems of anxiety disorders and depressive disorders. We are all multidisciplinary with our professional backgrounds in terms of who provides the training. And the aim of the course is really for you to attain a critical knowledge of the theory behind the models that we use in CBT and the evidence base according to the models and the protocols that we use, and really develop your core competencies, those fundamental CBT skills throughout the course and throughout the training. You would be based in Talking Therapy services. And really, you'll be at step 3. So if those of you who are new to IAPT, or what was called IAPT, now is called Talking Therapy Services, this is something you might want to kind of take a closer look at by looking at the Talking Therapies website. But we are based in CBT, is based in sort of step 3. So this is kind of thinking about providing 12 to 16 typically CBT sessions, as opposed to step 2, which is something that psychological wellbeing practitioners or PWPs administer, more of a guided self-help sort of format, or kind of shorter number of CBT sessions and other therapies. So, as I mentioned, this is the website we'd really recommend you take a look at. If you're new to Talking Therapy Services, you might be somebody who's currently working in a mental health setting, but it's not NHS Talking Therapies, or you might be very familiar with this. It's a national programme. It is really improving access to a range of evidence-based therapies, a lot of which is CBT. And we do have this stepped care model, which you'll read more about on the website. There was a sort of, I think it's a slightly outdated statistic. This is from a couple of years ago, actually, but there's a huge volume of people that Talking Therapies are designed to provide access for. And a couple of years ago, it was the aim for 1.9 million people to be seen through Talking Therapy services. So this is a huge NHS strategy, and hugely successful, and has got very impressive recovery rates. And so we use the high intensity curriculum to sort of guide a lot of our teaching that adheres to the evidence base that's used in talking therapies. So what do the courses involve? There are 4 modules, 3 of them are taught. So I'm just going to focus on those first 3 modules, because the 4th module is your accreditation portfolio, which is really bringing everything together in terms of all your assignments. So I'm going to talk really about the first 3, just to give you a taster, a flavour of what you would be covering in the year-long taught course. So the fundamentals of CBT, we look at really kind of fundamental principles, core competencies of CBT across sort of transdiagnostically. So that's things like Socratic questioning, being curious and exploring people's beliefs and how they came to consider them, thinking of alternative ways of viewing that problem. We look at more structural things like how you structure your CBT sessions, how you start off with setting an agenda. And we look very specifically at kind of cognitive techniques, and that might be sort of using guided discovery, might be using cognitive restructuring when you're working with a thought, and behavioural techniques. It's very rare that these 2 are very separate in a session, because it's often altogether cognitive and behavioural. But behavioural techniques might be things like behavioural experiments and testing out a thought together, a belief in the session together, or sort of really testing out beliefs around in low mood of things won't help me feel better, and testing those things out in session. We also focus on those kind of core competencies of relapse prevention. I'm very aware that some of these aren't unique to CBT. So for those of you who are not from a CBT background, you might be thinking, oh, that really fits with my experience as well. We also address and really kind of explore therapist beliefs. We have sort of reflective practice sessions where we do that a bit more specifically, but in supervision, that'll be something we're always encouraging our trainees to reflect upon. We look at the therapy relationship, when it might rupture, how we would work with that, sort of barriers to the therapy relationship, and thinking about sort of different characteristics of the people that we work with and how that might play a part between us and the client that we're working with. And we also kind of focus within the fundamentals module on evaluating research and taking a really critical approach and stance to thinking about the evidence base. How robust is it, and which parts of the model are best supported, which parts of the treatment protocol are most effective with which groups of people, and so on. So that's kind of usually the first place that we start, the first term often, are the fundamentals of CBT. And those, as I said, you might sort of relate to some of those, even if you're not from a CBT background. Then we kind of go on to thinking about anxiety disorders and depression. These are 2 separate modules. So anxiety disorders, we're really focusing in on the evidence-based CBT. We use specific kind of models that are evidence-based and recommended by NICE guidelines. So we teach on specific phobia, on panic disorder, on social anxiety disorder, obsessive compulsive disorder, generalized anxiety disorder, health anxiety, post-traumatic stress disorder. And across all sort of anxiety disorders, we think about how we work with imagery. And imagery is not just limited to anxiety disorders, of course. It can also be very helpfully used in depression. So these are the kind of core disorders that we work with and we sort of teach on the course. We also teach on BDD sort of towards the end of the courses. That's sort of a bit more recommended for post-qualification. But these sorts of areas we have a lot of specialist teaching on and a lot of skills groups on, and you'll really be encouraged to practice your interventions both in skills practice and teaching sessions before you kind of meet clients with these difficulties, as you'll be working with them alongside the training. Now, again, some of you might be looking at that list thinking, okay, I've got a bit of experience with 1 or 2 of those things, but really I've never seen somebody with maybe OCD or social phobia or PTSD. And really, when you're thinking about applying for the course, please bear in mind, you don't need to have worked with every single disorder that's on these lists. It's more having those kind of fundamental skills and a good amount of experience with some of these disorders, and really do flag in your applications what you've had experience working with and how you've been involved working with them. I'm just going to briefly kind of cover what we teach in the depression module as well. So there's an emphasis across both of those modules on diagnosis and assessment. And then with depression, we do focus on hopelessness and risk in terms of suicidality. We also teach that within the fundamentals module because that's a core part of the assessment. Again, we're kind of thinking about cognitive and behavioural techniques and how we use those when we're working with our clients with depression. We also look at physical illness, long-term conditions, adversity, and how that might impact on somebody's mood and functioning. Also within the depression module, there's sort of teaching on older adults, how we might be adapting and flexing what we do, depending on the age of the client that we're working with. We also look at chronic depression when it's been very severe for a very long time, how we might again flex the treatment and look at the evidence base for people with chronic depression. Again, across both, relapse prevention is a core part of our work. So we're really encouraging our clients to become their own therapists towards the end of therapy. We also kind of think about where there's personality traits or sort of more complex presentations, and we have some sort of teaching on that towards the end of the course. And rumination, which again is transdiagnostic. That's a sort of process that we find happens in anxiety as well as depression, but there's specific teaching on that within the depression module. So I'm now going to pass over to Rita.
Thanks, Alice. So Alice was talking about the content of the different models. I'm going to move into and talking a little bit about the different methods of learning and how you might acquire skills in those different areas. Both courses use a variety of different methods to help you develop your CBT skills and competencies. They will involve lectures and experientials. So you'll have lectures on those different, fundamentals of CBT, on, CBT for depression, etc. And then following that, often there will be skills practice in that area for the experiential workshops. That will also involve some skills training, some masterclasses, and of course, don't forget, there is a wealth of information that you could have access to, including KCL and Royal Holloway library resources, Oxford resources, BABCP training videos, NHS Futures, and for King's Keats. There'll also be course and site supervision. I'll go on to talk a little bit more about that in one of the latter slides. As both courses are post-qualification certificates, diplomas rather, we adopt an adult learning approach to education and training. What that means is there will be a mixed variety of methods involved in the learning process that tap into the different skills and competencies that you'll be required to develop. So if we look at this, there's an overlap between all the different methods of learning. So you will, in order to develop your knowledge in, let's say, fundamentals, in, let's say, different models in relation to anxiety, different models in relation to depression, what you'll have is formal training involving lectures and workshops in that area. And of course, that is going to be enhanced by reading outside, reading more about the different treatments outside, and reflection as well. Now, after the lectures, in order to put skills into practice, you'll be very much tapping into your clinical experience and reflecting on that in supervision. And of course, in order to build up on your skills, that'll be supplemented again by reflection in supervision and more clinical experience. So what you'll see here is there's always going to be an interaction between the different methods of learning. And it's a very intensive course, there is quite a bit of personal study that will be required during weekends and especially close to deadlines. So do bear that in mind. It's a mixed method of learning, but you will be fully supported within these different areas. If we think about the different levels of, well, different types of assessment involved in gaining your qualification. Both courses do adhere to the HI national curriculum, Pilling core competencies, as well as the minimum training standards from the BABCP. On completion of both courses, this would give you, both courses are level 2 BABCP accredited courses, and upon a completion of these courses, it will enable you to apply for registration or accreditation with the BABCP to become an accredited practitioner. Okay, so both courses enable you to do that. In order to get that qualification, what will be required from you are 8 CBT training cases which will be closely supervised, and these will be gained throughout your year. 200 clinical hours of supervised clinical practice. Don't forget, these will be split over the 8 training cases that are closely supervised, as well as your site cases. 70 hours of supervision. This will involve both supervision from the course and supervision from your sites, and a mixture of formative and summative assignments. The formative assignments will provide feedback in order for you to complete your summative assignments, which will include written assignments, essays, case reports, therapy tapes, which are self-rated and course supervisor rated, as well as supervision, mid-review and final reports. At the end of it all of this is summarised and documented within your accreditation portfolio. How does all this fit together? Well, how all this fits together is actually in order for you to become an accredited CBT practitioner, like we were saying before, we do follow the HI curriculum and the core competence framework, and the assessments that we've just talked about do tap into different methods of learning, do tap into the CBT core competences framework by Roth and Pilling. So what we've got here is, it looks like a very complex diagram, but in essence, a lot of you will have some understanding of different areas of these competences. So if we look at the generic competences in psychological therapies, what we're looking at here is knowledge and understanding of mental health problems, practicing within ethical guidelines, ability to engage clients and establish therapeutic relationships, ability to manage endings. So if we look at it from that perspective, it doesn't matter whether you come from a core profession or not, or a PWP, all of you will have those set of skills. So if you do come from a core profession and think that you don't have some of the core competencies, think again. It would be useful to highlight those generic competencies in your application forms because you have them. Then there are the basic, what's called basic behavioural and cognitive competencies, and these tap into some of the fundamentals of CBT in module 1. So what this is all about is the knowledge of basic principles of CBT, i.e. the role of, let's say, safety behaviours and how they contribute to the maintenance of difficulties, your ability to structure sessions, to plan and review homework. Now, if we distill that a bit further, what we're looking at there, then we then get into a bit more specific behavioural and cognitive techniques. So these would be things like how we might use thought records to evaluate NATs within depression. It could also be planning specific behavioural experiments within social anxiety or within panic. It could also be, let's say, planning behavioural experiments and then dropping specific safety behaviours. So those are specific behavioural and cognitive techniques that could go across the different presenting problems. Then within that, you will have ones that are split into problem-specific CBT skills. So here, what we're learning, what we're you will develop. And competences and knowledge of different models within different presenting problems. So, for example, when we've got depression, you'll be exposed to ideas linked into the Beckian theory of depression, as well as BA, Martel and Jacobson's theory for depression. Within those different models and within those different theories, there will be different ideas about what contributes to the development and maintenance of those difficulties, and therefore specific techniques that might be useful in addressing those. So that's what the problem-specific competencies are all about. When you've got a specific presenting problem, is there a model that you can use and understand the presenting problem with, and then linked into that, ways of formulating and ways of treating that. If we look at the basic specific competencies and the problem specific ones, these are the ones that the course, don't worry if you don't have them, these are the ones that the course will help you develop throughout the year. And of course, there are the meta competencies. This is looking at the ability to adapt interventions to the individual needs of the client based on feedback, how we might adapt interventions taking into account of protective characteristics and neurodiversity, and perhaps selecting the most appropriate treatment methods for post-appropriate treatment methods for the client, and managing ruptures and managing difficulties in the therapeutic relationship. So what this is all about is how you can tailor what you know to working with individual clients. And again, if we think about the different methods of learning, you'll be able to develop these competencies in reflection via supervision. Talk about supervision. Okay, supervision, they split up. You will never be more supervised than you are if you're on one of these courses, because you will get weekly course supervision, and that occurs in a group of 3 or 3 or 4, and you also get weekly individual supervision from site. There will be close liaison with the site supervisors if required, and all of our supervisors get supervision of supervision as well as supervision training. Right, I'll hand over back to Alice for her to talk to you about the entry requirements.
Okay, so as we've mentioned several times, this is a post-qualification, postgraduate diploma. So all of you will have had a degree or the academic equivalent of a degree. And a lot of you might have come from a PWP, a psychological wellbeing practitioner background, which means that you will go through the KSA, the Knowledge and Skills framework by the BABCP, which Sophie Mays will be talking about in a moment. But some of you might be from a core profession. So you've probably heard that term before used tonight, and it might be something you're familiar with. On the King's website, we have and on the BABCP website, there's a definitive list of what we mean by a core professional. But what we're talking about is people from a professional background of things like mental health nursing or mental health social work, occupational therapy, counselling backgrounds, and other counselling backgrounds as well. So if you are from a PWP background, you do need to have at least 2 years of clinical experience since qualifying by the time you start the course. So if you started in October, if you completed your PWP training and you were qualified by October 2024, then you are able to apply to start in October 2026 the courses. If you have less than 2 years, unfortunately, you're not yet eligible to apply. That's if you're from a PWP background. If you're a core professional background, it doesn't have quite the same 2-year guidance, but what we would say is that we do need you to have substantial experience working with common mental health problems of anxiety disorders or depression. And if you are from a counselling background, you do need to be either accredited or very close to accreditation. So you have a substantial number of clinical hours. And that's important really, because we want you to sort of be able to hit the ground running. As Rita mentioned, this is a demanding course, which our testimonials will sort of talk about a little bit later. And so it really is a huge advantage, and it's essential that you have a good understanding, you have a foundational knowledge of working with mental health problems, so that you can really sort of pick up some of these key sort of learnings from CBT when you start the course. So if you are from, I'm going to kind of talk about core professionals in a moment, to sort of really give you some tips of how you can really think about how you can apply and sell your skills on the, in your application. And then Sophie's going to talk about the KSA framework. Please do evidence your love of CBT and your experience of CBT through what you've done through continued professional development, CPD. And remember, there's lots of live work, you know, pre-recorded free workshops that you can access that I'm going to go through in a moment. So even if you're somebody with a PWP background and you've firmly been working in CBT for a long time, again, evidence of sort of expanding your interests by watching things around social phobia, which you might not have as much experience with, or PTSD, would be highly recommended as well, because this is a highly competitive across London process, and we have a high volume of applications, so it really is a competitive course. So really do think about how you're going to sell and really promote your CBT experience and interest in your application forms. Right, so thinking about the application, everything you need to know is going to be, well, is currently on the King's College London website at the moment, but it's for last year's. So watch this space. It will be available probably from end of March time. And on that will be up-to-date service descriptions across all of the services across King's College London and those associated with Royal Holloway will be up there, so you can really look in much more detail at that particular service. We're also going to make available the video that we will show later. Oh, sorry, my Alexa's announcing someone's at the front door. Good timing. It will go through, we will share the videos about some of, unfortunately not yet all of them, but some of the services have provided us a video, and we're hopefully going to get a few more. So if there's a particular service you don't currently work for, perhaps, or even if you do, and we've got a video, please do have a look at the information that we're sharing with you, because some of those videos will be available for you to view. On the website, we'll also go through the step-by-step of how you actually apply. So do look at this document called the application procedure. It is really helpful. It sort of really guides you through bit by bit what you need to complete and how. It will also provide you with a job description and the person specification to help you guide your personal statement. Please really do look at this and really outline how you meet the person specification, how you could do this job, and really kind of you're thinking about really focusing on your CBT or sort of psychosocial intervention experience. So really thinking, how can I make my experience, how can I show how clearly it relates to this job description and person spec. And lastly, there's your personal statement template. Please try and keep this succinct and concise. Again, really focusing on the really specifically target information about how your experience really fits with what this training program has to offer. But as I said, much more information will be available on the King's website soon. So watch this space, and we'll give you a link to that later in the presentation. So please go through KCL Apply. NHS Jobs may well advertise the jobs, but they will direct you to the KCL Apply website, and it will be very clearly available on the King's College London website. So we process all applications to King's and also Royal Holloway, because this is a pan-London application process. Okay. Please in your application, tell us which two services that you prefer. You get a first and second choice. And please note from the list of the sites which they are twinned with. So some are twinned with Royal Holloway. So for example, if you selected Hillingdon as a site you wanted to work from, you will be you will be attending uni at Royal Holloway. And if you apply for Lambeth, for example, that's twinned with King's. So you'd be coming to uni at King's. Please do give lots of clinical information, sell yourself. explain your role, and again, how it relates to this training course. So you might have lots of sort of generic experience working with mental health. Tell us in particular how it might guide back to the person's specification. And do look at the information we've given you in this presentation already. Look at the Roth and Pilling competencies. Like Rita was saying, think about those kind of core foundational experience you have and how it relates to some of those generic competencies and maybe some of the more specific competencies as well. Please keep it succinct. We have a lot of applications that we read through, so really think about how you can stand out. And please limit your personal statement to 2 pages ideally, and definitely only up to 4,000 characters. Okay, so I'm just going to focus on core professionals, and then Sophie's going to talk more about the KSA application route for PWPs and other non-core professionals. Like I've said already, consider what you have to offer already, your current therapeutic skills. So you will have lots of core psychotherapy skills, and you might also have been involved in groups with a CBT sort of structured format, or behavioural groups. There might be sort of motivational interviewing you've been involved in, or any other kind of psychosocial interventions, things like behavioural activation, behavioural sort of activity scheduling, maybe accompanying people to test things out in behavioural experiments. So some people have experience of working alongside psychologists or CBT therapists on wards, for example, and following a sort of care plan that maybe a psychologist or a CBT therapist has been designing. Any opportunities to shadow or observe CBT therapists or psychologists would be highly recommended. And please do sort of ask for, if it's possible, specific supervision or attending group supervisions where you could present cases and a CBT therapist or a psychologist might sort of offer their viewpoint and think about CBT models and how you can really put some of these CBT interventions into practice with your clients. Please do build up your knowledge. Tell us about short courses you've been on, any workshops you've attended, any webinars, so pre-recorded ones are fine, books, articles, journals, all of that really helps your application to strengthen it. I will talk about places you can find free webinars in a moment. And please just really read up on NHS Talking Therapies and how step 3 works, what that looks like. Speak to other people who've done the course if you can find any, or speak to other people who might know about the course already, and read the job specification and much more about the course, and think about how your skills apply. So the BABCP website is a brilliant place to go to access information. If you are a member, you can access lots of pre-recorded webinars for free. If you're not currently a member and don't fancy becoming a member at the moment, that's absolutely fine. You can, please do have a look on Apple or Spotify or wherever you get your podcast from, and look up, if you just search for BABCP, this is just one that I really recommend, called Let's Talk About CBT. And there's a whole load of interviews that they've done. There's a whole load of sort of informational podcasts about what CBT looks like, and different interviews of different experts, which is really fantastic to listen to. By the way, you do need to become a BABCP member when you start the course if you're not already a member. But obviously when you're a member, if you get a place on the course, you can then get student membership. So that's just something to be mindful of. But if you have any colleagues who are BABCP members, maybe you could go around and watch a webinar with them through their membership. Although we would strongly encourage you to get your own. Anyway, Oxford Centre for Anxiety Disorders and Trauma, often abbreviated to OXCADAT. On the OXCADAT resources website, and the link is given to you at the end of the presentation, there is loads of free content. These are restricted to social anxiety, panic disorder, and post-traumatic stress disorder. Okay, so again, whether you're a core professional or a PWP and you don't have experience of these disorders, we would highly recommend that you watch. There's day-long workshops that you can access for all 3 of those topics. Please do watch those and find out more about how CBT works for those difficulties. You can also read articles, you can read manuals. Please just make sure that you register as a clinician, because then you can get the full content of free training materials. NHS Futures is open to any healthcare professional with an NHS website, so please do sign up if you haven't already, and please look and join the platform for NHS Talking Therapies for anxiety and depression. Those workspaces, again, have lots of brilliant free webinars over the last 5 or 6 years, so please do have a look at what topics are available under the events and webinars section. Right, I'm going to hand over to you now, Sophie, to talk about the KSA framework.
Thanks, Alice. So I'm going to talk to you briefly about the KSA, which stands for Knowledge, Skills and Attitudes. And this is a BABCP requirement. And the reason why the BABCP have designed this this process is to ensure that people have the correct knowledge, skills and attitudes in order to be able to undertake the course. So obviously the BABCP welcomes people from different backgrounds with different levels of experience, but in order to demonstrate those skills, some of you may be required to submit something called a KSA portfolio. Could you put the next slide on, please, Alice? And so in order, if you're applying for the course, you will need to meet the criteria for the training, and this will involve demonstrating knowledge across different areas and writing about these. If you are a core professional and you have a relevant core profession, then you would be exempt from doing this. And this is why Alice actually mentioned that in most parts, PWPs will be the trainees that will be completing the KSA portfolio. If you look on the BABCP website, if you go on to the next slide, Alice, it will give you quite detailed information about different professions and who will be required to complete this portfolio. So, for example, if you're an occupational therapist or a mental health nurse, you may be exempt. However, people who have been in careers such as working in probation or midwifery may need to do additional sections of the KSA to evidence that they are compliant. Could you put it on the next slide, please, Alice? Thanks. If you complete the KSA portfolio successfully and in a timely fashion, so we need people to be compliant with KSA at the point of entry, of course. What this means is in the future that you will be eligible to apply for BABCP accreditation once you complete the course. So it sort of makes the process nice and smooth. So everything you need to know is on the BABCP website. If you follow this link, it will give some really clear information really about the process. Something I want to highlight with you today, though, is that if you are a PWP, there is the option to go through what we call a condensed route, which means that the KSA portfolio process is a lot less burdensome. And in order to be able to go through the condensed route, you need to be registered with the BABCP or the BPS in good time. So if you are thinking about applying for the course, do register if you aren't already, because it will save you work in the future. It also gives you a very clear list of the core professions who's exempt and who will need to complete the portfolio. So do take a look at that because all the information is there. Next slide. And then, so upon interview, there are some things that you will need to look at and would be helpful to look at, and we'll obviously ask you what's required. But one of the things that is part of the KSA is completing something called a clinical experience record. But also to have some awareness of criterion 4, which is awareness about different modalities, your knowledge about these modalities and how you might apply these or this knowledge in clinical practice. And we are looking at offering training in order to have awareness of these modalities in September. We're actually bringing this training forward a bit, probably around mid-September. Royal Holloway provides this training. And also we're looking for people to actually submit their portfolios prior to the course commencing. This is something that we're changing this year. So it may mean that you'll be working on your portfolios over the summer. Royal Holloway will be providing training on the modalities training, which is part of Criterion 4, but also myself, I will be providing some training for King's, and I'm sure for Royal Holloway, in order to sort of really understand how to complete the portfolios, and we'll be supporting you with that. Is that, yeah, so I'm just handing back over to Alice now.
I think you might, Rita, were you going to do these things? Yeah, thank you. Except Rita, you're muted.
I'm unmuted.
There you go.
Typical. Typical. Okay. On the next few slides, what we've got here are useful websites that have been referred to throughout this talk. So do have a look at them. There are different websites for different things, so you'll get general information about the BABCP, obviously from the BABCP one. The KSA is also on the BABCP one. There's training resources from Postgraduate, NHS Talking Therapies, and NHS Futures. Slide, please, Alice. And with the course application, do think the only way to apply for this, even though it might be advertised elsewhere, as Alice was saying, is via King's Apply. There is different information about the KCL course and about the Royal Holloway course on those respective websites. Recruitment outline, just to give people an idea of what the proposed timeline could be. And of course, all of this will be confirmed and a little bit later on, and you'll all be notified of that. So the proposed timeline is this. The application portal could open in April. Interviews will happen shortly after in May or June on Teams. Then obviously, you know, you will be starting your training contracts with training contracts and contracts with your sites closer to October, when both courses start. The proposed start date for King's is the 5th of October, and for the Royal Holloway one, it'll probably be the 2nd week of October. As Sophie was saying, the KSA modalities training will be sometime in mid-September, and depending on which site you had, generally the inductions for the sites will begin end of September, beginning of October. So in terms of the application process and when those interviews are, when the portal is open, it is generally in April with interviews in May, but these dates will be confirmed. Okay, I'll hand over to Alice with some of the testimonials.
Thank you, Rita. So we've got some videos coming up, but we just wanted to read a few that people had sort of kindly given when we asked for some feedback about both courses. So these, I'm just going to read some of these out, and then I'm going to show you some videos actually from the services first, and then onto some trainees. The course has changed my life. I'm now an accredited CBT therapist, effective CBT practitioner, and clinical supervisor. This course offers an in-depth CBT training experience. The quality of teaching is very high. The course does throw a lot of manageable challenges your way. However, this is a stimulating opportunity to learn, as you are treated as a competent CBT therapist from the get-go. I think that one really emphasises that you do hit the ground running, as they say, because after the initial kind of 2 weeks or the induction period, you will be starting on site to see clients from potentially week 3, and you work for 3 days on site and 2 days you go to uni. So you are seeing clients from the get-go. So I think that's a really helpful sort of testimonial there. So are the other ones. It will be a very intense year, and being open to the learning and development experience is useful. Embracing it as being there to help you grow and develop. I haven't heard anyone say, I wish I hadn't done the course, but I have heard it said, I wish that I had done the course. So again, there's an emphasis of this is a challenging course, and seeing it as a growth mindset is highly recommended. Contrary to the rumours about CBT in comparison to counselling, I discovered a significant opportunity to reflect on feelings, behaviours and responses. Training can evoke unhelpful past experience and feelings. Through the CBT I employed with my clients, I was able to alter their thinking, emotions and behaviours when they were unhelpful and not beneficial to learning CBT. It was wonderful to have these new tools and to know how to apply them. So this person is obviously from a counselling background and is talking about, yes, there's a steep learning curve to learn a completely new, well, not completely new, but pretty new modality, and actually having, again, using the CBT skills yourself and having a growth mindset is really important. So at this point, I'm now going to hand over some videos. I think there are 5 or 6 different sites, and this video is about 11 minutes long. And there are representations from different services talking about what it's like to train with them. I'm then going to show a couple of videos just from 2 different trainees. And then I'm hopefully going to hand over to a live person who's one of our trainees from last year to talk about her experience as well. So I will start off with Kieran, who's from Hammersmith and Fulham. And hopefully I've shared sound. Rita or Sophie, could you please tell me if you can hear this when it starts?
Hi, my name is Kieran. I'm one of the CBT therapists at the Hammersmith and Fulham Talking Therapy service. As part of the West London Trust, I'm going to tell you a little bit about our service. In terms of demographics, so like most, we have a very diverse population. We have recently seen an increase in the borough of residents age 50 or older. And in regards to religion, again, it's just diverse, but there is a high representation in the borough from those identifying from a Christian or Islamic backgrounds. And we also have a range of people from different heritage and ethnicities. That also includes a range of people identifying as mixed heritage as well. So we come to the part that you're probably most interested in terms of why would you want to come and work for us? Well, we provide loads of support. So in addition to supervision on the course, you'll also get a site supervisor for clinical cases. We have a duty system for your triages. You'll have access to a line manager, of course, but also a buddy. And what we aim to do is get people started slightly before the course to help with things like inductions, getting used to the site, systems, and we also provide workshops at the beginning and the end of the course to give you an idea about what to expect from the next steps in your career.
Hi, I'm Fru, and I'm one of the senior clinicians at Talking Therapies. I thought it might be helpful to tell you a little bit about the service if you're considering doing your training with us. We're a well-established service as one of the original IAPT sites from back in 2008. We work with a very diverse population in Newham, and our team reflects that. We're made up of a CBT team and a relational team, but we do have lots of specialist services within the service, such as eating disorders, long-term health conditions, psychodynamic, couples therapy, EMDR, and narrative exposure therapy. During your training, you'll be offered an hour of clinical supervision per week and an hour of line management. If you're new to IAPT, we would make sure that you get the extra support that you need. If you feel overwhelmed or if you feel that you need that little bit of extra help from your line manager or your supervision, we can always discuss extending those sessions for you. We hope you consider training with us and would like to work in a service that gives you an opportunity to learn from lots of colleagues with different expertise and different skills.
Hi, I'm David and I'm the clinical lead at Richmond Talking Therapies. This brief video is to tell you a little bit about our service and what you can expect if you were to join our team. Richmond Talking Therapies is a well-established service since 2012, and we have an excellent team including cognitive behavioural therapists, psychological wellbeing practitioners, relational therapists, and more. We understand that training in a new modality can be challenging, and we're keen to support our trainees through supervision, conversations with your line manager, and of course through your colleagues here, many of whom will have been through the training themselves. We are a well-performing service that is keen to deliver the best possible care to the citizens of Richmond, and we hope you'll consider joining us for your training.
I'm Michael Thompson. I'm a senior high intensity therapist at Mind in Bexley, and we provide the NHS Talking Therapy service for the Borough of Bexley. And I personally have a special responsibility for looking after our trainee HITs. I hope you're really enjoying the open evening and having all of your questions about the course answered, and I hope a lot of you are really keen to proceed with an application to the course, which I can tell you is an excellent experience. And I hope that plenty of you will also consider putting down Bexley as your first choice as well. In regards to our borough, we are in the southeast of London and have a slightly older demographic than most, with the third highest population of elderly people out of the London boroughs, and about we're reasonably diverse borough. We have quite high levels of support for our trainees with remote and in-person supervision, as well as a full induction, including a crash course in NHS Talking Therapies for our colleagues from coming outside of Talking Therapies, as well as a top-up with an introduction of CBT for people from non-PWP backgrounds. We do offer hybrid and face-to-face roles within our service, and our trainees will be working regularly from our main office, which is just off of Bexley Heath Broadway, where most of our face-to-face appointments do happen. We have an exciting range of therapies within our service, from guided self-help, CBT, interpersonal therapy, and EMDR, as well as dynamic interpersonal therapies, and well-established perinatal and LTC pathway as well. We provide treatment for the full range of common mental health problems at both Step 2 and Step 3 in a one-to-one and group-based format. So we hope you consider working with us and putting in an application, and I hope you enjoy the rest of your evening. Thanks. Bye.
My name is Brad Turner. I'm a senior practitioner at the service, and I'm also the high intensity training lead.
Hi, my name is Callie, and I am a CBT therapist in Barking and Dagenham IAPT. When I started, I got a pack, with sort of what to expect and how sort of the induction week was going to go. And I got 2 weeks induction, which in other services I've had one. So 2 weeks, and I got a lot of training in that. And I think it's also good because here they don't, they don't put too much focus on numbers. They care about people. They care about, the employees as well as the clients, that we're working with. I've had a lot of support. And I felt really welcome. My caseload is manageable. My work-life balance is the best that it's ever been. I used to be a mental health nurse before, so now I see the difference in my work-life balance, and there's a lot of support. So the client population is very diverse, multicultural, people of different backgrounds and experiences. I feel sort of job satisfaction because I feel that I'm actually making a difference, because you can really see the difference from you start the work and then you end the work.
Building on what Callie has said, you have your weekly clinical supervision, you'll have your monthly kind of line management and case management, making sure things are all going smoothly. In addition, when you're a trainee, you'll be given a high intensity buddy, which is somebody that you're a qualified colleague who you'll get paired up with, and who will be there for any support that maybe falls outside of your clinical supervision, or things that are maybe just a little bit more ad hoc with certain policies or systems or processes. And there is something, as the high intensity lead, something that I'm working on is to get a robust system in place where we've got more regular peer supervision, protected time for that, in-house regular training, maybe building on the fundamentals of CBT, and then sort of expanding to include maybe things that were kind of like additional disorders and additional kind of challenges that we can work through, and supporting people when they then become newly qualified into what is also a difficult kind of challenging time as well, when you're increasing your caseload and working with clients with slightly more challenges or complexities. So making sure that there's support structures in place for people when they're newly qualified in that sort of preceptorship kind of period as well.
Hi, I'm Tamara Lord. I'm a Step 3 team lead and CBT therapist from Lewisham NHS Talking Therapies. I'm here to talk to Nina, who is one of our current HI trainees at Lewisham, and her experiences so far. Hi, Nina.
Hey.
You used to be a PWP for our service. So what's the transition been like from PWP to HI trainee?
So I guess the transition's been really smooth. As I was a PWP before, I already had a bit of foundation of knowledge around CBT, having worked in it for a couple of years. And then also knowing the team at Lewisham as well made it a lot quite smooth. But I guess there's definitely challenges. So for me, it was feeling quite de-skilled. But there's loads of processes in place in Lewisham to support you with that. I think there's a buddy system. You regularly meet with your line manager. You meet weekly with your case manager. You're introduced to other trainees who are further down the line, so they're there to support you as well. So although feeling de-skilled, there's a lot of things out there to help at the same time.
Thanks, Nina. And what's your experience so far been like as a HI trainee?
Really positive as a trainee with Lewisham in particular. I think, firstly, you get to do a 6-month placement with CADAT, which is the Centre of Anxiety Disorders and Trauma, where essentially you get to be supervised, you have clinical skills with, and you get to shadow, leaders in the field, people that are leading research and experts, which is so golden as a trainee to have access to something like that. And then with Lewisham as well, although I'm with CADAT at the moment, but I have never felt disconnected from Lewisham. I'm always checking in with my line manager, with my case manager, with different people, just generally who work at Lewisham. So they're always there to support you and they want you to pass and do well. And lastly, there's also working groups as well. So different working groups with the aim to essentially improve outcomes for different sections of society in Lewisham. So as an example, I'm part of the LGBTQ working group, and to, support some of those groups as a trainee. You don't have access to that with, different services. Sometimes you can only do your training. So that offers some diversity to the role as well. And yeah, another positive part of why working for Lewisham is something that's been a really good experience.
Oh, amazing stuff. Thanks for talking to me today, Nina.
Thank you.
So we hope you found those videos helpful. Those were just kind of a snapshot. Those were just 6 services out of the many services that we have that we work with alongside with Royal Holloway and King's. I'm now just going to move on to, these are just 2 videos. It's about 5 minutes. First of one of our trainees who qualified 2 years ago now, last year, and then somebody who's just qualified this year. And then we're going to have a real life person talking, so not pre-recorded. Catherine is very kindly joining us to talk about her experience of getting onto the course and completing the course as well. So I'll play these quickly first.
My name's Edward. I'm one of the PWPs who was on the King's course. Completed the course very recently, but it's a short video sort of trying to give my experience, I suppose, of how King's was, and I think coming as a PWP. So before I went onto the course, I think I sort of thought, sort of high intensity training is just going to be like low intensity, but just with you learn extra things. So I was already coming with certain skills and a certain understanding, but starting the course, you very quickly come to realize that it's not, or it wasn't what I was expecting anyway. It's different. It does take a lot of what you knew as a PWP, and it kind of reshapes it, remolds it with the support of all the tutors, the lecturers. The teaching was is still actually amazing. We do have lecturers who are top of the field, really. I don't think it's blowing trumpets to say that. But yeah, they have really, really good teaching, and a very supportive staff as well.
Hi, I'm Zoe, and I completed the CBT postgrad diploma at the end of 2025. And I just want to give you a few words about my experience. I joined the course having worked as a mental health social worker before, so I didn't have any experience working in talking therapies, and I had never kind of given CBT directly. I was a bit apprehensive joining the course because I knew a lot of people who were joining had worked in talking therapies before, but it wasn't a problem because at the beginning of the course you have 2 weeks that are quite kind of intensive, and it kind of gets everyone up to speed with the CBT basics. And I also found some of my experience working in secondary care and as a social worker actually helped me sometimes, and we were able to kind of learn from each other, because I also worked on the course. There were people who had been OTs and nurses and counsellors and doing different types of therapy in the past, so we all kind of learned from each other, which was great, and that really kind of complemented everyone's learning. I loved going into uni. With the 2 uni days a week were always a highlight of my week. We had great lecturers who often themselves had been